Good morning. My name is Robert Bullard, and I direct the Environmental Justice Resource Center at Clark Atlanta University in Atlanta, Georgia. And first of all, I really like the way this summit opened. As Dr. Cashin and I was discussing, usually when you go to a summit, you usually have the talking heads first and then the community respondents at the end of the meeting. So this is really great. Growing smarter strategies for building healthy and sustainable communities. If we look at this whole idea of sustainable communities and economic development, for the last 35 years I've been working on issues of land use, housing, economic development, environmental quality, institutionalized racism, whether it's environmental racism or redlining. I've written 15 books on this stuff, so I know a little bit of something about a little bit. If you look at this whole idea of what smart growth is, it's basically saying that we have to bring into this whole realm the idea that smart growth is not doing it the way that we've always done it. It's not enough just to talk about economic development, but what type of development? Because in some cases you can get development that can kill you. And so when we talk about this whole question of growth and place and where the jobs are, place matters. But also, as we heard earlier, race matters. One of the most important indicators of health, or predictors of health, is your zip code, where you live. And when you talk about this whole question of place and race, healthy places and healthy people are highly correlated. And so if you talk about how do we get to a healthy place and healthy development, all development is not created equal. And so when we talk about economic development, be careful what you ask for, because you may get something that you don't want. So when we talk about the built environment and health, the built environment impacts health and quality of life. And the built environment includes infrastructure and all kinds of, whether or not a community will have access to a park, a full-service grocery store. Yes, it's not just Birmingham, but even in Atlanta. A lot of our communities consider having a full-service grocery store as economic development, whereas in the suburbs and middle-class white communities, a grocery store is something that is assumed, that is taken for granted as part of the fabric of a community. The geography of vulnerability. We're in the South, and there are a lot of belts in the South. We talked about the Black Belt, the Sun Belt, there's a poverty belt, there's a fat belt, there's a diabetes belt, there's a stroke belt, and there's a pollution belt. I've done research on all of them. And if you look at this belt, and there are certain states, and part of this project, there are certain states that's part of that, or those belts. It's not a good belt. There is no money belt. And so when we talk about this whole question of poverty, and if you look at where the poverty belts are, poverty correlates highly with the Black Belt. And so when you talk about the healthiest states in the country, the richest states in the country, it is not coincidental that not a single southern state fits into the top 10. If you look at the unhealthiest states in the country, Mississippi and Alabama generally, well, not in Alabama, Louisiana generally fight between who's going to be 50 and 49. Right now, Alabama is 48. This is not me saying this, this is Forbes. And so when you talk about this whole question of the fat belt, you can look at the states where, you know, obesity and Mississippi, and you start talking about Alabama. And so there's a stroke belt, there's a diabetes belt, there's a childhood asthma belt in terms of the 10 cities, the top 10 cities out of 100 that are considered asthma capital. And again, Birmingham's number 3. When we talk about mapping inequality, and we can map inequality, we can map economic opportunity, we can map good health, and we can map illnesses and disease. So having mapped that, what do? And it means that some of it is part of our policies. Racial redlining is real. You can green line and say, we're going to create this green empowerment zone, this healthy empowerment zone. Very few of them. Most of our areas are green line. I'm sorry, a red line. Redlining is coming back. With the economy going sour and housing going south, redlining now is insurance companies and banking and finance companies. Our communities now, communities of color, are now suffering disproportionately from redlining and what it's doing to our communities. You look at mortgage rates, in terms of who's getting the predatory loans, where are the foreclosures, all of that is impacting health. You have a community that basically has been abandoned, where grocery stores have left, where the supermarkets and infrastructure in terms of banks, financing, all kinds of things, abandoned. And so it's not just the fact that in many of our communities, services have also been redlined. Hurricane Katrina destroyed Charity Hospital, but there was no Katrina that closed DC General or King Drew Hospital in LA, or Grady Hospital right now is, it's privatized, but at one point it was hanging on by its fingernails in Atlanta. And so when we talk about supermarket redlining and the fact that we all would like to have a Whole Food store, but it costs money. Some people say, that's not whole food, that's whole paycheck. And so when you talk about this whole issue of even a half Whole Food would be great. Crossing this food desert, desert is something. We all know what a desert is. This photo has nothing to do with anything other than I was in Egypt Christmas. We all want healthy foods. We want farmers markets. We want to have supermarkets versus liquor stores. This is Oakland, West Oakland. Look at all of the yellow dots. Those are liquor stores, one green dot. In some places you can get liquor and guns at the same place. I don't know any white people who drink Colt 45. Drive-through liquor stores, unhealthy by design, easier to get a hamburger than it is an apple. We all would, we don't have to call names. We want our kids to have fruits and vegetables, but we all know that what's in our community is not healthy. And it ends up basically having all kinds of problems. And so when we talk about unhealthy neighborhoods, some neighborhoods zoned for bad health, and some neighborhoods physically located on the wrong side of the tracks, we know that there are some communities that are more likely to be dumped on, poisoned, polluted. And it's not just, we know what clean air does. A study that was just published showing that as we clean up our air, we extend the lifespan. And at 62, an extra 5 months, I want my extra 5 months. And so when we talk about the data, we know the sources of pollution. We know that air quality and pollution, it's deadly. And so when we talk about the kinds of things that we want and where the pollution is and where the health problems are, and people are saying, I'm tired of smelling the air. What is the price of clean air in a clean city? And the fact that some of it is us. Smog is created mostly by cars. And when we talk about the vulnerable population, we know who they are. They're children. They're asthma epidemic. And the fact that we are now dealing with diseases that are preventable. And we talk about illnesses. It's costing a lot of money. And poor people are hit the hardest. Almost half of the public housing projects in this country are located within a half-mile radius of a polluting facility. This is not trick photography. What am I saying? Am I saying that what's coming out of the smokestack is making people sick? I'm not saying that. What I am saying is that what's coming out of the smokestack is not health enhancing. So when we talk about the impact of having so many communities located next to these dangerous facilities, it's very clear. Dead people don't vote. And so we talk about green access. Who has access to the green economy? Is the green economy for everybody? And not just green money, parks and recreation facilities. All parks are not created equal. Look at the park. This is not trick photography. This is in Louisiana. This is a community and a park located between two refineries. I'm going to call names Shell because I have tenure. Shell Oil. And so when we talk, not BP. And so when we talk about green zones for kids, even our schools are not safe. And so we talk about our children are being poisoned. And these red dots represent where the schools are and where the big pollution dots are. And there are dots in Alabama. We talk about green jobs and the green economy. Is the green economy for everybody? As the country goes green, in many of our communities of color, it's not even talked about green. We're still getting the brown and the dirty. And so when we talk about 6 schools, if we retrofit schools to make them green and high-performance schools, those are jobs that are created in retrofitting every school that's in Birmingham and in the Black Belt. We get performance. We get extra learning points in terms of having green schools. It costs a little more initially, but the payoffs are great. 7 times investment. That's good. You spend $10 and you get 70 back. That's a pretty good investment. And so when we talk about growing green, greenhouses, fixing up homes, healthy homes, not just lead, but the entire home. We talk about building greener. We're talking about investments. The price of indoor air. In a lot of homes, indoor air is worse than outdoor air, making people sick, preventable. And so we talk about renewable energy. We talk about clean energy. And look at the states. This is another one. Look at the states that's green, and look at the states where there are no policy. Alabama is white up on the map. But Alabama is not white. And so we're talking about getting a green economy to move in the right direction. They're building windmills off of Cape Cod. At the same time, we're still stuck on dirty industries, dirty energy. And so these power plants located across some schools. Madness. You look at the dirty dozen, and look at Alabama. It's in there. In the dirty dozen, there are 3 plants in Georgia. And so what's raining down on people in these power plants? It's mercury. Not good. Creating health problems. And we know what the problems are. We're stuck on coal. We're hooked on coal. There's no such thing as clean coal. It's a fantasy. And so when we talk about going green in terms of green energy, that big spill up in Tennessee with that power plant spill, all that stuff, that coal ash, when they decided where they're going to put it, where did they ship it? They shipped it to Alabama. Perry County, Alabama. It's so nasty and so dangerous to be in East Tennessee, they shipped it to Alabama. And so the idea is, right now, Alabama has become the dumping grounds for all kinds of toxic waste and toxic materials. Is that economic development? That is not sustainable. And finally, I think it's important to understand it is unlikely that we can achieve any level of sustainability and any level of livability and health if we are not to address the issue of equity. And if you want to know more about what our work is about, you can check our website out. Last takeaway, read my books. Don't wait for the video. Thank you.